My name is Taylor DePlanchi, and this is my analysis of frontotemporal dementia, also known as frontotemporal lobe dementia. The analysis of frontotemporal lobe dementia shows that its most common types of dementia in early life Alzheimer's disease and frontotemporal lobe dementia. Two types of frontotemporal lobe dementia are behavioral variant frontotemporal lobe dementia and primary progressive aphasia. Pathophysiology. Frontotemporal dementia is the atrophy of the frontal and temporal lobes of the brain. This may affect speech, memory, and behavior, as well as many other traits. Frontotemporal dementia, also known as FTD, has two subtypes. This includes the behavioral variant frontotemporal dementia and two types of the primary progressive aphasias, including the non-fluent agrammatic and the semantic. Epidemiology. This particular disease may present in individuals younger than 65 years of age. It is the third most common cause of degenerative dementia after Alzheimer's disease and dementia with Lewy bodies, accounting for 5 to 10% of all pathologically confirmed cases. These patients might have a history of psychosis or another family member who might have FTD. There's also been research that shows that genotypes play a part in patients who have FTD. Psychotic symptoms have been found to be especially common in both progranulin and C9orf72 carriers, sometimes even presenting years before dementia onset. These genotypes might predict the behavior that is shown in FTD. Clinical presentation. Differential impairment in behavioral, executive, and language functions early in the disease course. With all three, there is relative sparing of short-term memory and visuospatial abilities early on. And with the two language syndromes, behavior is also intact. Right predominant atrophy patients tend to be emotionally cold and distant, often disrupting family relationships, and present with the behavioral disturbances that are often misinterpreted as psychiatric symptoms. Left predominant atrophy patients mainly present with language impairments. Assessment and diagnostics. Two types of primary progressive aphasia, which is degeneration in language caused by frontotemporal dementia. These types are non-fluent, agrammatic, and semantic. Non-fluent agrammatic has at least one of the following characteristics: grammaticism in language production, apractic speech, which is effortful, halting speech with sound errors, and at least two or three of the following features: impaired comprehension of syntactically complex sentences, spared single word comprehension, and spared object knowledge. This may be shown by an MRI, SPECT, or PET scan, and it will show atrophy, hypoperfusion, or hypometabolism of the frontotemporal lobes. With semantic PPA, both of the following core features are shown: impaired confrontation naming, impaired single word comprehension. At least 3 or 4 of the following other features: impaired object knowledge, particularly for low frequency items, surface dyslexia or dysgraphia, spared repetition, and spared speech production, such as grammar and motor speech. This can be shown on PET and SPECT scans, and what will be shown is a prominent anterior lobe atrophy, hypoperfusion, or hypometabolism. Treatment for FTD includes selective serotonin reuptake inhibitors, or SSRIs. And while atypical antipsychotics may be used, they should be used with caution given side effects. There have been new developments in the course of ideologic treatments, including anti-tau antibodies, antisense oligonucleotides, and progranulin enhancers. In conclusion, frontotemporal lobe dementia is common in patients younger than 65 years of age and may be predicted by genetics, genotypes, and a history of psychosis. It is best managed by SSRIs and may be proven via MRI, PET, or SPECT imaging. Frontotemporal lobe dementia also is characterized by speech, memory, and behavioral issues. Thank you for listening to my presentation on frontotemporal lobe dementia. I hope you learned a lot and have a wonderful day.